An innovative surgery at a Montreal hospital has helped a Quebec woman regain the use of her hands after a spinal cord injury. Jean Carrière became a quadriplegic and was unable to use her lower body or her hands after breaking her neck 2 years ago. Alison Northcott is in Montreal with more on the surgery and its aftermath.
Well, the surgery Carrière had is called a nerve transfer. And while it's becoming a more common type of surgery, it's mainly for nerve injuries on hands or feet. But applying it to patients with spinal cord injuries like Jean Carrière is newer. Carrière is 27 and she became quadriplegic after she broke her neck in 2021. And she was able to regain a little bit of arm movement before the surgery, but she wasn't able to use her hands. So our colleagues at Radio-Canada's science program Découverte, they were there for Carrière's surgery and they captured this incredible footage. And what the nerve transfer surgery does is it reroutes the nerves above the lesion on her spine, nerves that are still communicating with her brain, and it reroutes them and attaches them to nerves that are no longer functioning, essentially to reconnect those nerves to the brain. So have a listen to Dr. Eli Bogosian. He's one of the two surgeons who operated on Carrière, and he'll explain how it works.
What we are doing is basically using these functional pathways, these nerves that are still working in the upper extremity, and transferring them to muscles that have no more electricity. So basically we are rerouting the nerves and bringing new electrical input to these denervated muscles. So with time, the patient gets a function back and mobility eventually.
So following the surgery, it can take several months for the brain to adapt to those new pathways and for the nerve fibers to grow into the muscles to bring those muscles back to life.
The patient in this case, Alison.
Well, Carrière says that it's really made a world of difference for her. These aren't major movements. It's things like pinching and grasping, but those are things that have made a huge difference for her because they've helped her to regain some independence. So it means that she can pick things up. She can prepare food and feed herself more easily. She can do her makeup, and she says she can type. And for her, that was one thing that was really important because it's meant that she's been able to go back to work, and she works as a screenwriter. So have a listen to Carrière talking about some of those changes.
I can move my hands, I can grab like the milk and do my coffee. So it's not like I can go to the gym and do but it's all the little things that I wasn't able to do. Now that I can do it, it's like all my world is changed.
So the surgeons who operated on Carrière, they've done about 14 other similar surgeries, and they describe it as a life-changing surgery for people with spinal cord injuries because of that independence that it can offer them. And they're hoping to do more surgeries like that in the years ahead. Other researchers say that they're really watching this field closely. Not everyone with a spinal cord injury is a candidate for this kind of surgery, so it's not a guarantee that it could necessarily help everyone who is quadriplegic. But experts say that it does provide some hope and that this could evolve as they learn more in the years ahead.
That's the CBC's Alison Northcott in Montreal.